Hey, this is Dr. Bert Solomon with Knoxville Spine Sports, and I'm with Shonda, who is part of our PT group. And today we want to have a discussion about diastasis, what it is, how do we treat it, who is most likely to have something like that. And so tell us a little bit about like what diastasis is, diastasis recti, and who's most likely to get something like that.
Well, a diastasis recti is just an opening in the abdominal wall. And it's most common in women that have had pregnancies, but I've also seen it in athletes, I've seen it in men. So we've treated not only women, we've treated both kids, children and men. So it can happen to any of us.
Yeah, that's right. It can happen to any of us.
Yeah.
Different age groups get it. I mean, you could be overweight. You could just have like really weak core muscles. It's surprising. It's really surprising to some guys.
Yeah.
Super hard workout in the gym. You know, they're CrossFitters, and yet when we check them, they have
I've
a
actually had
diastasis.
men come to me and say, there's something going on with my core because I'm as strong as I've ever been, but I don't feel it. Like there's something missing.
Yeah.
And it's their core, because your core it's your center. It's everything. And
that's right.
everything is built upon your core.
That's right.
And so if your core is weak, it's like the foundation of your house is weak.
Yeah.
And so
That's a good way to say it.
I've treated lots of bodybuilders even
Yeah.
that want to get stronger, and it's amazing what just strengthening your core will do.
Well, and even like rib flare, right? Like sometimes they may not have a true diastasis. Maybe they do have it with a rib flare, but even with rib flares, we want to draw that back down and in.
Exactly.
And we use some of those same exercises that we would for maybe a diastasis.
Exactly.
As a chiropractor, I was not super familiar with this until I was educated by you and Carolina and some other physical therapists, and it really was eye-opening, right? So like you could be you could be a chiropractor who just isn't really familiar with what a diastasis is, how to correct it. And the more I started checking for that in my patients, specifically with like low back pain, SI joint issues, it's chronic. They're always needing to be adjusted. Something just, they're working out, they're doing their exercises, but there's just something not right. And maybe it's a diastasis. So I'll have you guys come and check. And a lot of times you guys will find the diastasis. And then we can co-treat.
Yes. And it's interesting you say about chiropractors, because one of my first patients was a 4-year-old boy, the son of a chiropractor in Chattanooga, and they drove all the way to Knoxville because he knew that his son had an opening in his abdominals, but he did not know how to close it. So he had read about us online. He came, we treated that little boy. We taught his dad a whole lot, and the mom too. The whole family came. And because the little boy never closed in utero, and sometimes that happens, and they have bowel issues their whole life, and that was part of the little boy, and just a lot of balance issues as well, because you need your core to stay up. And so he knew something was wrong. And so that was a beautiful thing to be able to treat. It was hard to treat a 4-year-old, but so wonderful to see the progress that he made, just getting his diastasis closed and his core stronger.
Yeah. There's nothing better than knowing that your kids are doing well and
Absolutely.
Good well-being. Now, as far as like, how do you check for a diastasis?
Well, we have the patient laying on their back with their knees bent, and we go in by hand, and we go by finger length. Some therapists will measure centimeters or whatever. We use our fingers, and we do how deep, how far in we can go, and then how, when we have the patient raise their head, that automatically engages your core.
Yep.
And so you'll feel a little squeeze, and if you don't feel that squeeze, you keep putting more fingers in until you feel that squeeze.
So you check it by having the patient lay on the back. They're in this kind of sit-up position. They barely raise their head and chin off just enough to engage the abs. And what you're feeling for is basically like two ridges kind of grabbing your fingers. So the abs would kind of grab her fingers and squeeze in. And if you've ever found one, it's the first one I ever found out. It was kind of shocking. It just feels like the ab muscles are like grabbing your fingers as you poke into their linea alba. From the sternum down below their belly button. And we check in several different places.
We do. We do right at the belly button, and then we do right above it, and then we do below it.
And those measurements, to be abnormal, they're different. Like if you have the width of two fingers at the top, but yet you have four fingers at the belly button, that's abnormal, but
yeah, you might not be open the same.
That's right, the whole way,
all the way up.
Yeah,
it's like a zipper that's
right.
Caught.
Yeah, it's a good analogy.
Now, a two finger at the belly button is considered normal. So if you can reach in there and you feel it won't close all the way at your belly button because of the belly button. So, but that's also like the door being left open a little bit. So we're very vulnerable there. Because there is always a tiny opening. It won't ever close there, but we consider it closed because
it's normal.
Belly button, that's normal. Yes.
Yeah, and so one of the things that even if it is normal, you still don't want to neglect your transverse abdominis, your rectus abdominis. You still want to work on your core even if it's normal. So just because you have a normal measurement doesn't mean that I can just check out and not work on my core. Like we all need to be working on our core. Because it's the foundation as you were talking about. And so
I've had people's shoulder pain go away when they've closed their diastasis just because they're just so much stronger. When we start to bend as we get older, we think that it's our back. It's our core that's breaking down. It's causing us to go forward and having a lot of the back issues and shoulder issues. So I've actually seen people be so much better in their shoulders just because their core is strong and their posture's better.
Absolutely. That's good. I'm trying to think if there's anything else. What would be some homework that you would give them? And how many visits is typical? Do you see them twice a week for 6 weeks?
Well, typically, we on the initial evaluation, we give them a whole packet. You'd get a packet and we'd show you exactly what to do. Some people grasp that right away and some people do not. It seems so difficult in the beginning, but it is very simple exercises, and I think that's what people can't understand is that I can close this by doing these simple things. You don't need to do a bunch of things that you would do in the gym that you think, oh, this is going to get my core stronger. No, sometimes we're hurting ourselves by doing things in the gym that we just don't know that we're hurting ourselves. So we do send home specific exercises, and we sort of take some things away from you.
Yeah.
Like if you're doing yoga and you're on all fours, we take that away from you only for a couple of weeks. Yes, because we need to see what you're doing that's hurting you or keeping you from closing your diastasis. So the best thing you could do is just to see us, come see us, and let us look at you, let us measure you, let us help you, let us show you what to do. And a lot of it really is up to you, and you do a lot of the work on your own. So there's simple exercises, but it takes a lot of work at home. It does.
You can't just rely on the therapist to massage it out or to strengthen it while you're here. I mean, it's a lot of education.
Yes.
It's a lot of feedback.
Yes.
Right. And it's a lot of engagement one-on-one, right? You can't have 7 other people in the gym doing therapeutic exercises while you're trying to work on somebody's, diastasis. And so really getting that one-on-one care with someone like Shonda or Carolina just pays so much dividends when you're dealing with something so so necessary. Right?
Absolutely. And the beautiful thing about learning to strengthen your core and to close your diastasis, if you have one, is that this is a lifetime. It's a lifetime exercise. You know, your abs are the one muscle group that you can train every day, and you can only get stronger. Whereas you would not want to train all the other muscles in your body. You can't train them every day. It would wear you out. But your core, absolutely. And these you'll have for a lifetime. And you'll be able to teach your friends. You'll be able to show you'll be able to recognize it in other people, that how weak they are. And you can just continue with what we teach you to teach other people. It's beautiful. We want you to. Like we want people to be stronger in their core because we see so much weakness.
Yeah, it can help so many things, like you were saying. It can help the torso, it can help the neck,
Yes.
it can help the shoulders, it can help rib flares,
Low
back, SI joint dysfunctions.
Yes, pelvic floor pain.
For sure.
So much.
Yeah.
That especially us women that's had babies, we just go through so much more. And it's just amazing the results that I've seen over the years of teaching people these simple exercises.
Yeah, it's awesome. So if you have any questions about a diastasis or how we treat it, you can call the office at any time. We'd love to talk to you. If you have any questions, you can leave them in the comments down below. And I just
want to add this.
Yeah.
Here at Knoxville Spine Sports, belly checks are always free. You can always come in and let us measure you. It won't take you a couple of minutes. You just need to make sure that I'm here, Shonda or Carolina.
Yeah, that's right. So I won't be doing that. I'll let them do that. This is Dr. Bert Solomon with Knoxville Spine Sports. I'm here with Shonda, and that's our little bit on diastasis recti.